What's going on with COVID-19 vaccines? Will you be able to get a shot this fall? The answer to that may depend on your age, your health status, your insurance, and whether you can find a pharmacist who will deliver the shot. Here's what we know as of late August. First, what's changed this year? Well, the FDA approval is more limited. The new shots are intended only for people ages 65 and older and younger folks who have a health condition that may make them vulnerable to a bad case of COVID. Healthier adults and children may have a harder time getting a shot. We also still need to hear recommendations from a committee called ACIP. They advise the CDC on who should get these shots. Health Secretary Robert F. Kennedy Jr. hired that committee earlier this year, and the people he picked to replace them have yet to make recommendations. Why does that matter? These recommendations trigger some pretty important things. They mean your health insurer will pick up the whole bill for the shot, and in some states, pharmacists can only provide vaccines that come with that recommendation. So if you want the shot, who's going to pay for it? Well, Medicare will cover it for people ages 65 and older. For anyone else, you should probably check with your insurer to see what your coverage will be like this fall. You want the shot, but where can you get it? COVID-19 vaccines will still be available at your local pharmacy, but some drugstores may have to wait for that committee recommendation. Some pharmacists also may be reluctant to provide a shot to somebody who doesn't fit the FDA's approval criteria. A doctor's prescription may help with that. You should check with your local pharmacy. The bottom line, the situation is evolving. You may have to do some legwork to figure out where to get a shot this fall and who's going to pay for it.